Hey everybody, this is Dr. Steve, and in today's Movement Minute, we're going to talk about a complex movement called the side bridge. Not complex because it's difficult, complex because it covers so many different areas of the body. This is a great exercise or activity to stimulate or activate the hips, the gluteal muscles. It'll get your core activating, it'll get your shoulder stabilizers working, and if done well, it'll take some of the stress off the upper back and neck. You know how sometimes in a relationship, one person in the relationship does a disproportionate amount of the work, and therefore they kind of get a little cranky, a little stressed, sometimes a little bitter. That's not uncommon with the relationship between the neck and the shoulder. So oftentimes this upper back and neck does a disproportionate amount of the work, and then patients come to me and they say, I am always tight here. I'm always irritated, I get adjusted, I get massages, and this tightness up here always comes back. What that tells me is that this is doing too much of the work, and the shoulder's maybe not doing enough. So the side bridge is an excellent activation that can take some of the stress out of these muscles in the upper neck, but it can also do some work in the hips and pelvis, so we may be doing this for a multitude of different reasons. So let's get started on how to perform this, and probably the most important part of how this is done correctly is a concept called the hip hinge. So the hip hinge is that ability to move or hinge from the hip. So if you need to practice this idea of what it feels like to hip hinge, this is a good way to do it, is just getting that movement through here. This is how the exercise starts. We're going to lay on our side with our knees a little bit in front of us, so we're not in a straight line, we're a little bit in a box. First part of the exercise is to push away from the floor so that we're making a nice straight line between the elbow and the neck. Second part of the exercise is to make sure that the core or the spine is nice and aligned, nice and straight. Third part of the exercise is hip hinge, pushing the hips forward and hold it. You want to hold this position for about 15 seconds, and then as you bring the hips back down, you hip hinge back down. So again, I'm thinking push away from the floor, straighten up the spine, push through the hips, hold for 15 to 20 seconds. Hip hinge back down. Some other things that you may encounter is you may have a little bit of difficulty with the shoulder, being a little uncomfortable. Again, we don't want to do any activity or exercises that cause or create pain. So if you're having some discomfort in the shoulder, before we give up on this exercise, try one thing, is when you push away from the floor, you can use your free hand, hold and stabilize that shoulder, and see if it feels a little better to go ahead and do that hip hinge. Another thing is when I'm trying to dissociate these muscles that are doing too much work in the neck and get this muscle down here doing its job in stabilizing the shoulder, is while I'm in the side plank, I'll have you turn your head. So the neck muscles are doing neck muscle jobs, and the shoulder stabilizers are doing shoulder stability job. Hinge your hips back. So it's been a great review of the side bridge. This has been today's Movement Minute. I'm Dr. Steve, and we'll see you soon.